DW AfricaLink.
From thousands of lives lost in 2015 to just 52 malaria-related deaths last year, 2025, Ghana seems closer than ever to be a malaria-free country. But health officials say this has much to do with a change in strategy. Ghana has moved its strategy from malaria control to malaria elimination, targeting total elimination in 10 years. But what is Ghana getting right? And can it realistically join just 5 other African countries declared malaria-free? This is AfricaLink, the podcast that connects you to the stories that matter across Africa. I am Adwoa Tenkoramaa Domena, your host for today.
AfricaLink, every weekday here on DW.
So growing up in Ghana, one of the diseases that troubled not just my mother, but many other Ghanaian parents and caregivers was malaria. Your child running a temperature, having chills and headaches in the middle of the night is not particularly exciting, especially with the knowledge that this is a killer disease. Even today, when I wake up with those dreaded chills and feeling like a mountain has fallen on my head, I'm reminded that malaria is very much alive and kicking in Ghana. And for some people, this is a life and death situation. In 2015, Ghana recorded more than 2,000 deaths from malaria. A decade later, in 2025, however, the country managed to significantly reduce the numbers to 52 deaths. Disease prevalence has also reduced to less than 9% of cases across the country. Authorities attribute the success to a shift from malaria control towards malaria elimination. The game changer is implementing an effective vaccination campaign. Ghana was one of the first 3 African countries which started the implementation of World Health Organization's recommended malaria vaccines. 6 years later, after beginning this implementation, how close is the country towards disease eradication? For this discussion, I have Dr. Yaw Peprah. He is Deputy Program Manager for Ghana's National Malaria Elimination Program. I also have DW's Mawuena Egbeta. Doc, definitely my first question is going to go to you. For Ghana, what would you say has been the impact of this vaccination exercise for nearly 6 years that we've been implementing this?
Yeah, thank you very much for the question. I will say that it's been very effective. We consider it as an additional tool to all the other malaria control interventions. It's usually very difficult to separate the impact of the individual tools. So if we talk about the reduction of the prevalence over the years, reduction of the malaria mortality over the years, what we say is that all these tools have contributed to the reduction we are seeing. So for instance, the Ghana picture is such that from 2011, we estimated our prevalence around 28%. But this has reduced over the years. 2019, when we started the implementation of the vaccine, it was around 14%. And now the last survey was 2022, which was estimated as 8.6%. So that reduction we have even seen from 2019 to 2022 is showing that, of course, with all the other interventions, the vaccine is also contributing to the reduction of malaria prevalence. Also, with respect to our malaria-related mortalities reported in our hospitals, we have also seen reduction over the years. 2011, we were recording close to 3,300 malaria-related mortalities. This has reduced over the years to 52 cases last year. And this is all a combination of all the interventions we use, including the malaria vaccine. It is very effective.
So I'm glad you've spoken about the numbers. You have given us a clearer picture of the last survey you had, which was in 2022. Now I want to understand, you mentioned also that the vaccine program sits within a whole coordinated structure when it comes to tackling malaria. What can you tell us about Ghana's broader malaria control strategy?
Great, thank you very much once again. The malaria elimination strategy, and I'm glad that you are asking this question because we have actually had a paradigm shift from having a control mindset to an elimination mindset. So in 2014, we adored an elimination strategy, which more or less is looking at a subnational approach to gradually get malaria eliminated from Ghana. So in the first 5 years, from 2024 to 2028, the first goal is to reduce malaria-related mortalities by 90%, reduce malaria incident by 50%, and we've actually also identified 21 districts in Ghana that are very close to elimination. So the approach as a program is to put in interventions to push these 21 districts into elimination, learn the lessons, and scale it up. So we have 3 main goals. And to help us achieve these goals, we have had control interventions that deals with the vector. We have a multi-pronged approach. We have interventions against the vector. We have chemopreventive interventions, and then we have our vaccines. Then in the event that anybody has signs and symptoms of malaria, we have the case management interventions where you test, if it is positive, you get treated. Then other cross-cutting interventions are the advocacy, social behavioral change, communication strategies, research, surveillance, monitoring, evaluation, and then procurement, supply chain management. So basically, those are the key interventions we have as a country.
And have they been working since you started implementation?
Yes, actually, I believe that the cumulative effect of these interventions actually is what is showing in the data, where you are looking at the reduction, as you rightly mentioned, around 192 per 1,000 cases, now reduced to 151 last year, and then prevalence reducing from 28% to 2011 to almost 9% or specifically 8.6%, and the mortality is reducing from the thousands to now 52. So it's a combination of all of this intervention. And now for us to move into elimination, we are bringing on new intervention. I'm sure as we have these discussions, I'll get opportunity to discuss some of these new interventions.
Very well. Yes, you will. But Mawuena, let me come to you now. In terms of community reception and how these interventions have been working, what can you tell us?
Right, Adwoa. And so initially there was concern of hesitancy on the part of recipients. And if you're very much aware of this vaccine rollout program, it started off in a pilot phase. Doc can attest to that fact, which is now being rolled on to additional districts, a bit more in terms of districts now receiving it. And so in the initial phases, I mean, it's expected that there will be the concern as to hesitancy, whether or not it is potent. And then for persons who have all of these conspiracy theories against the use of vaccines and what have you, that continues to, or that was a part of the concern which was raised. That has improved greatly. But I'll be very honest, in the lead up to this conversation, even I was speaking to some colleagues who are here with me in my office, and I asked about how well they want their kids to receive the vaccine. And a number of them were like, okay, they really are not too sure if it has received the all clear to that extent. And these are persons who are very educated and know about the vaccine rollout. And so the hesitancy has been there. I think with improved education, we're seeing the rollout as well pick up from the initial 43 districts. I think between now and 2029, they are seeking to cover a lot more than half the districts in the country. In Ghana, we have 261. They're seeking to do more than half of that number by 2029. And so hesitancy, even in very advanced and developed countries, it continues to be there. But there has been significant improvement in that regard. Reason why we're seeing the rollout pick up as well, Adwoa.
Interesting. Doc, do you have anything to say about the efforts you've been putting in place to tackle this hesitancy and how it has changed over the years?
I agree with Mawuena. I think that usually when you start the phase implementation of vaccines, you usually have these challenges. So we had these challenges. We have had to engage the media, talk to journalists, go to communities, engage community, in fact, even engage health workers, because you need to get them to understand what the clinical trials results were, what the challenges were, and how we can go around them. So that has been done. the data currently shows that we've made a lot of progress. For the RTSS 1, 2, and 3, the first dose is taken at 6 months, second 7 months, the third 9 months. For these 3 doses, we are doing more than 75% for all of them. And for a new vaccine, that is really good. So what that basically means is that we are doing very well with the advocacy. Of course, there's still a lot of opportunities for us to explore. So I agree that we are not there yet, but we have come this far through a lot of advocacy, and we need to continue to do that. And one of the things we're also trying to look at is to target populations and communities that have these hesitancies, because you need to know what their issues are. So for instance, if you get to know that a particular community doesn't want to take the vaccine, we go in there, explore the possible reasons why they don't want to take the vaccines, develop advocacy and communication strategies to address them.
How many children or how many people have received the vaccines as of today?
Currently we are in 132 districts. We started with around 42 districts with RTSS1, added on the comparators, that was around 51. And then when we started the R21, we've added about 43 more districts. We've currently done about half of the districts in Ghana.
That's encouraging. Let's talk about funding now. International development aid has significantly fallen. The last figures I saw this year is that it's falling by nearly 23%, which is the lowest level since around 2015. What risks do these funding difficulties pose to malaria prevention or elimination programs in Ghana? I know there is Gavi, there is a Health Alliance and WHO who are also supporting, but what risks are we facing at the moment?
So thank you very much once again. I mean, if you have external donors doing about 50% of your implementation budgets, if there's reduction in that space, definitely is going to affect you. So we actually risk having retrogression in the progress we have made over the years. Currently, the PMI USAID support we were having before the stop order came in was around roughly about 25 million US dollars annually. So if that is gone off your budget, that is a huge amount that is gone off. And because the US also supports Global Fund, and the Global Fund is one of our main funders, that indirectly also affected us, because the funds we were having from Global Fund also reduced. And that meant that a lot of our interventions had to be either put on hold or had to be reduced in scale. So I think that this has been a huge blow. What the government has been doing, for instance, is to look at how to front load some of the commodities that, for instance, Global Fund or Government of Ghana was supposed to have supplied in 2026, 2027, front load it as we look for opportunities to close the gap we have in commodities because of the stop order. Of course, we are hearing news of a new opportunity with the US government. MOUs are being discussed, and hopefully, if that comes in, then the possible commodity gaps should be fixed. But definitely, with the stop order, it has really affected the implementation of the program activities. And unfortunately for us, once again, for instance, interventions like indoor residual spraying, which is very, very effective, we unfortunately will have to stop doing that because we don't have enough funds to cover that. Seasonal malaria chemo prevention, which we usually do for 5 rounds, we couldn't do for all the 5 rounds because we didn't have enough funds to support that. And of course, some of the surveillance interventions we needed to do, we couldn't do it as well. So we really risk retrogressing if we don't address this. I know our government is doing a lot in this space to try and address this issue. I also personally believe that this gives us the opportunity as a country to own the fight against malaria, because countries that have succeeded have actually championed the fight themselves and have contributed significantly so that we don't over-rely on external support.
Right. Thank you. I'm going to come to you on what suggestions you have for Ghana to own the fight. But Mawuena, one important aspect that we cannot overlook is the issue of self-reliance. I know the conversations have gone on about Ghana having its own vaccine institute. How far have we gone with that?
So on the vaccine institute, the last thing I recall was it was commissioned by the previous administration, and so all of the work has been done in that respect. But as to production and the moving forward, that will require a bit more in terms of funding. Last year, I recall when the challenges with USAID became dominant as a result of the position of President Trump, the president directed the finance ministry to provide funding to fill in the gap. As at the end of last year, per the financials, it wasn't too clear. And with this, Doc will have to help us because they sit at the front where the monies will have to come in for us to know whether or not the funding was able to fill in the gap which was created by USAID. From our perspective as journalists and having monitored the space, it hasn't been quite clear as to whether or not government intervention has been enough to cover for the hole which has been created. Now comes in the element of the Vaccine Institute as well, and the fact that there will be the need for a bit more in terms of funding because government subvention alone cannot cater for it. And so we will go full circle and private sector participation will be required. At the last time I recall, there was a direct appeal to the private sector in Ghana to as well contribute and support in that regard. We're yet to get any word or confirmation as to whether or not they've been able to hit to that call and to see steady progress in terms of us beginning a massive rollout of our own vaccines.
Right. Thank you so much. Doc, let me come back to you. You were going to talk about solutions and how Ghana can self-finance, even before Mawuena threw the ball to you about government's intervention and how far it has gone to help the situation. Can you talk to us about that?
Yes, so I agree with Mawuena's point that government cannot do this alone. Government more or less did a strategy to ensure that the shortfalls we had will not affect us. And that is why you have not heard about stockouts of any of our commodities. So the strategies included getting some commodities in and also ensuring that even the commodities that were supposed to have been procured in 2026, 2027 are front-loaded as they mobilize more resources to get that done. And of course, with the uncapping of the NHIE, we are hopeful that some of those things will be sorted out. With the indoor residual spraying, for instance, government is in discussion to try and expand the coverage of indoor residual spraying. So yes, government is doing a lot to support that, but government alone cannot get this done. And that is why one of the things we are doing as a program is to do a lot of private sector engagement. Some years ago, we had EcoBank, for instance, supporting us with some thousands of dollars. We have other mining sector partners also supporting the malaria elimination program. We are pushing for more private sector engagement so that we can mobilize more domestic resources for this fight. And that is very, very important, especially with the circumstances that have been created recently. Now, apart from the domestic resource mobilization, one of the key things that is required to help us eliminate malaria is community ownership. We need to get everybody in Ghana to understand the need to shift from a control mentality where we think that we have stayed with malaria for long and, it's not killing us that much, so we're just okay with it, to the point where we know and believe that we can't eliminate it and we want to eliminate it.
Doc, can we really eliminate it? And within what time frame are we looking at this elimination? I see the WHO has driven to end malaria. Now we can, now we must, as this theme, the 2026 World Malaria Day. Can we really end it?
Yes, it is very possible. That is why the global community is now thinking about it, that this is the time, because we have all the tools available to do it. And the opportunities available to ending it is now, because it makes more economic sense to do it. A study that was done in Ghana shows that if we are able to end malaria, the returns on the investment is about 32:1. So economic-wise, it's even better. Now, availability of tools. Apart from all the interventions I mentioned, there are new tools coming up every time. We used to have challenges with insecticide resistance. Now we are having new generational insecticides that is more or less a way to overcome the resistance challenges we had. So a lot of good things happening. So we need to take the opportunity to eliminate it. As a country, we modeled the feasibility of eliminating malaria and then when that elimination can be done. And we realized that we could do it even within 10 years if we improve on all the things we have been doing based on the plan we have, right? So malaria elimination in Ghana can even be done in the space of 10 years, but it all depends on having the resources available to implement it.
All right, thank you very much. Mawuena, in the minds of the populace, do you think elimination is possible within the near future?
Absolutely. For anybody you speak to, and I believe you're Ghanaian as well, you would have suffered malaria at some point in time in your growth. And even now for us as adults, you suffer malaria every now and then if you're not too careful and you expose yourself to a lot of mosquitoes. And so to that extent, there is the expectation by a vast majority of individuals that, look, we can end it, particularly amongst the much younger generation, because as we've grown older, we've taken a lot more precaution to avoid having to get malaria. But with the onboarding of this vaccine rollout, there is even now the distribution of nets across the length and breadth of the country. There is the vaccine institutes, which the current president pledged $50 million to, and a host of other interventions, even for families having to go through the entire toll of your child suffering malaria. They are of the view that, look, better off if this all comes to an end, and then we can focus a lot more resources to other things. And so for the average Ghanaian, and dare I say the average African, it will be in our best interest if inarguably one of the biggest killers in terms of children is eradicated completely.
Thank you very much. Well, to tell you what, I have had malaria for many times than I can count. And I'm one of the people who really want to see an end to this. So we really want to see, this come to an end sooner rather than later. So thank you, Mawuena Egbeta, DW correspondent in Accra, Ghana. Earlier, you heard Dr. Yaw Peprah, who is the Deputy Program Manager for Ghana's National Malaria Elimination Program. Gentlemen, thank you so much for your time.
You're welcome. Thank you.
Health officials in Ghana say vaccine hesitation is one of the key barriers to achieving full vaccine coverage across the country. Some parents in Accra, Ghana, have been sharing their experience with the vaccination program.
First of all, the government needs to educate the parents about the drug, because drug cannot be given to the children whilst parents are not having any idea about what is going to be injected to their kids.
But your government,
it's a good thing. If the government is bringing a malaria vaccine, it will help our children. I think all parents should accept it so that our children can be protected.
Oh,
the malaria vaccine is good. For me, I think they should have brought it a long time so that it would have helped the children earlier. But since it's here now, I hope the government will continue so more children can benefit. It's a good initiative, but my concern is about the side effects. Some of these vaccines come from outside the country, and sometimes we hear they test them elsewhere first. So there's a bit of fear. But if it's safe, then it's a good thing for the children.
As the World Mass Malaria Day on April 25, Ghana is joining the rest of the world to rally for an end to malaria. 47 countries across the world have been certified malaria-free, with 5 being Africa, namely Algeria, Lesotho, Cape Verde, Mauritius, and Seychelles. Ghana says 21 districts in the country are now close to elimination. But Ghana is not alone. Kenya, Uganda, Nigeria, and the Democratic Republic of Congo are among the countries racing against time to eradicate the disease prevalence. What is the status of the fight against malaria in your country? Share your thoughts with us on Facebook and on TikTok at DW Africa. Listen to us on Spotify or wherever you get your podcast. And don't forget to subscribe to our DW Africa YouTube channel. This show was co-produced and edited by Kai Nebe, and I am Adwoa Tenkoramaa Domena. Bye for now.
DW, made for minds.